As a board-certified psychiatric pharmacist, I often get questions from media, other providers, as well as pharmacists themselves about what pharmacy's role is or the pharmacist's role is in the psychedelic renaissance or the reemergence of psychedelics within medical research and clinical practice spheres. In this video, I want to address 7 of the most common questions that I get around this topic so that you can hear my thoughts firsthand. Let's go ahead and dive right in. Question number 1. What is the role of the pharmacist in the area of psychedelic medicine? Well, I'll have to say that from a big picture angle, pharmacy is really about 2 things almost always. Number 1 is safety, and number 2 is efficacy when a drug is employed for a therapeutic intention or a therapeutic indication. And while psychedelics are substances that certainly have special effects and considerations to them, they're not unlike any other drug, substance, or medicine in that there are risks, benefits, contraindications, side effects or adverse effects that are possible, as well as persons that may benefit lots, as well as persons where the risks of use could actually outweigh benefits. So the pharmacist's role in psychedelic therapies is similar or parallel to the role of the pharmacist in any other area of medicine. Screening candidates or applicants of psychedelic therapies for drug-drug or drug illness or drug disease types of interactions, suggesting doses or dosage adjustments based upon end organ function or other aspects of the screening process are probably areas that are bread and butter to the clinical pharmacist. However, pharmacists are also involved in the safe and effective distribution of medicines or drugs. So thinking about what are safe protocols for use, what are emergency protocols that should be in place when psychedelic therapies are conducted. This is another area where the pharmacist can offer a lot of expertise and benefit. Lastly, I would say that pharmacists are educators of other providers, and educators of the public. And psychedelics are the types of substances that carry a lot of stigma, and there's not a lot of great objective information that is currently available due to the legal status and overall lack of high quality clinical research that has been able to be conducted in the last 50 years. So there are many roles that a pharmacist could play in the psychedelic renaissance. However, the roles that they ultimately should play are not different than the roles the pharmacist plays in other areas of medicine. Question number 2. Why and how should pharmacists be involved in the psychedelic landscape? And I think that there is some overlap between questions 1 and 2 here, but the most succinct answer is that every time it's studied, data supports that pharmacists improve outcomes, reduce harms, as well as reducing the overall costs or expenditures to the healthcare system. The truth of it is that mistakes, errors, harms to patients, and therapies that do not work out because of lack of efficacy cause a great burden of costs upon the healthcare system, as well as great torment and distress to patients themselves. So having pharmacists involved to optimize these things at the outset is one very compelling reason to me for pharmacists to be involved in the psychedelic landscape. Question 3. Why do most pharmacists not want to discuss the use of psychedelics at this time? Well, I don't believe that this is a phenomenon that is unique to pharmacists. I think there are many different types of medical professionals and healthcare providers that are truly hesitant to discuss the therapeutic use of psychedelics at this time, and probably most of their reasons stem from the regulation of psychedelics as Schedule 1 or illicit types of substances. For example, when drugs are regulated as illicit substances, it creates a lot of difficulty in conducting the type of high quality clinical research that most evidence-based healthcare providers, pharmacists included, really need to be able to discuss therapeutic uses in an intelligent way with their patients. It also disincentivizes academic institutions as well as professional organizations that offer training programs, education, or continuing education for pharmacists around therapeutic or positive uses of psychedelics. So this creates a really large knowledge deficit and educational gap, and pharmacists, amongst other healthcare professionals, simply don't have the confidence or information available to have the types of discussions that they really like to have with their patients when they're discussing medicinal use. Question 4. Since psychedelics have been illegal for decades, how would you approach and have an open conversation with a pharmacist about psychedelics? I think at this time I would encourage you to employ some judiciousness in the pharmacist that you approach, and perhaps the time that you approach them to have this kind of conversation. Choosing a pharmacist that you already know well and trust, or choosing a pharmacist that works in a setting in which psychedelics may ultimately be employed. Psychiatric pharmacists, perhaps neurologic pharmacists, or pharmacists that work in pain and palliative care types of settings or clinical settings are much more likely to have time and a higher level of knowledge and awareness around psychedelics. You should also open with a general style of question rather than a personal style of question. For example, you could ask something along the lines of, have you heard about the recent research with MDMA-assisted psychotherapy for post-traumatic stress disorder? Or have you heard about the research with psilocybin or the component of magic mushrooms as far as being a treatment for depression? What do you think about that? By opening with a general style of question that aims to get an idea of what that pharmacist knows about existing research, you're going to be able to gauge if you really want to broach personal territory and ask things more along the lines of, well, do you think that this treatment has promise for me? Or do you think that overall I might be a candidate for this type of therapy if it were to be legally approved? Question 5. Do you think pharmacists are more likely to recommend traditional psychiatric medications than illicit psychedelic substances? Well, yes, I do. And I think this because there is a really heavy premium placed upon being evidence-based as well as acting within accordance with both state and federal law in doctorate of pharmacy programs. Pharmacists that break the law can have their pharmacy license revoked. And for most pharmacists, their pharmacy license really represents the ticket to their livelihood, job, profession, or career, and is not something that they're going to be willing to risk. It's truly unfortunate that prohibition or the regulation of psychedelics as illicit substances prevents evidence-based healthcare professionals from recommending their use, but it really does. And from this perspective, healthcare professionals may have to act in more evidence-biased than evidence-based types of ways. Even for myself, as somebody that specializes in talking about psychedelics and educating people about psychedelics, I really consider myself to be an information dealer in that I do not recommend that anybody use psychedelics. In fact, I recommend that they do not break the law. However, I am also open to giving them the information that they might want or are desiring and allowing people to choose or make up their own minds about the things that they engage in their own life. Question 6. What consequences could a person face when admitting psychedelic use or illicit psychedelic use to a pharmacist? Right off the bat here, I want to say that pharmacists are healthcare professionals. They are not law enforcement officers. So the chances of an individual facing any type of legal ramification for admitting illicit psychedelic use or illicit drug use otherwise is very, very low. I think the primary consequence that persons may want to be concerned with would be the type of stigma, judgment, and potentially even documentation in their medical record that they are an illicit drug user or a person that has engaged with illicit psychedelics in the past. And I think, again, this goes back to a previous question around how to broach the conversation. And if you have broached the conversation with a pharmacist with a general type of opener and found a pharmacist that is knowledgeable about the data and seems to have a positive and open mind or attitude towards psychedelics being therapeutic, I think that this would be the type of person that you may really want to admit psychedelic use to, because you may actually be able to teach them or share with them about your experience and about how it was helpful. Now, if you have had psychedelic experiences that are adverse and you are suffering from different types of post-use consequences, you may also want to admit this. I don't believe it does people any good to go to a doctor and say, I feel this way, or go to a pharmacist and say, I feel that way. And they ask, why do you feel that way? And you really gloss over or omit part of the picture there. So when it comes to speaking about illicit drug use or admitting to psychedelic use with a pharmacist, perhaps some judiciousness is required. However, overall, I think individuals can be quite confident that they won't be facing any type of legal ramification because of their admission. Okay, number 7, our last question, back to a bigger picture type of focus here. What do you think is the most important thing for people to know about the future of psychedelics? To me, the most important thing for people to know is that there's space for it all, and the train has truly left the station, meaning that we are in a period of rapid expansion of psychedelic use and an exciting period of revival of psychedelics within medical research, as well as decriminalization movements and the uses of psychedelics for religious or psychospiritual types of practices. So I really think that what I want people to know is that there's truly space for it all out there. I'm a proponent of cognitive liberty, meaning that I believe persons should be able to access substances that produce non-ordinary states of consciousness like psychedelics in a variety of safe and supportive types of containers, and that it's not going to be good enough simply to legalize psychedelics in medical contexts and only allow people with severe or treatment refractory types of mental illnesses to access them. There are many different medical professionals that I've seen kind of sing this tune or narrative that psychedelics are so dangerous that use outside of medical contexts are likely to cause high levels of harm. However, when I look at toxicologic data, when I look at observational data from poison control centers, I can't really find the smoking guns or reasons that this would be true. In fact, compared to just about any other type of illicit and sometimes even controlled prescription medication out there, psychedelics have lower levels of harm to the general population and are actually associated with lower odds ratios of past year mental illness. On the flip side, you have many non-medical professionals that have countercultural or anti-establishment modes of thinking who believe that the development of psychedelics by the pharmaceutical industry and the redeployment within medical contexts is going to end up tainting psychedelics and creating poisonous or adverse types of outcomes for people involved in psychedelics within those medical use contexts. And I believe this to be categorically false because if you look at the research that has been conducted, over a dozen double-blinded clinical studies in small populations, but highly rigorous types of studies with psychedelics in the modern era, not a single one of them has yielded negative results, and the majority of them suggest unprecedented types of benefits to persons that were enrolled in those trials. So I believe that there's truly space for it all out there with psychedelics, and it's going to require some patience and time to get different types of regulatory structures in place that safely allow for all of these things to occur. But I ultimately believe society will be better off if that is our goal or aim, and that's what I want people to know about psychedelics and their future. Well, that's a wrap on the 7 most common questions I get about psychedelics and pharmacy or pharmacists. I hope that you enjoyed the answers and responses to these questions. If you did, I would encourage you to subscribe to my YouTube channel, follow me on social media, Instagram or Facebook, or better yet, subscribe to my email list. I do offer psychopharmacology consulting around psychotropic or psychiatric medications, as well as psychedelics, as well as several evidence-based courses in psychedelic pharmacology, as well as antidepressant tapering in preparation for psychedelic therapies. Lastly, I have a monthly or annual membership or subscription service that allows you to access all of the courses, webinars, and drug interaction guides that I put together around psychedelics and psychotropic medications, as well as have discounted rates on my private psychopharmacology consulting practice. Until next time, stay well, and I'll see you soon.